Thank you, Mike, and thank you. I feel very honored to be here today just to speak to all of you about 211. And the first thing, so my name is Brenda Ludwig, and I'm with United Way of Yellowstone County. And we're actually not a 211 center, but we partner with 211s in the state. So I'll get in a little bit more as I get on with my presentation. I'll let you know where those agencies are located. But before I get started, I want to know by a show of hands, who's familiar with 211? Okay, Mike, there are people that know about it.
Yes, great. I like it.
So for those of you that aren't familiar, 211 helps people get connected to services. And so I'm showing this slide, and John and Jackie Giddens from the Voices of Hope in Great Falls are going to talk more about 988. But just we want, so help us 3 numbers away, as the slide says. So 211 is to help people with basic needs before they are in a crisis. So they can call 211 or go to our website to help them get connected to those services. And then 988 is for those crisis calls. But I think it's important for people to know that, just as Mike said, they're interconnected because they use the same database. So 211 is a free and confidential service, and you can contact 211 any time of day, just by 24 hours a day, 365 days a year, just simply by dialing 211. And in Montana, so 211 is part of a national network, but in Montana, as you can see on here, we have, does it sound like there's an echo? Am I too close to the microphone? Oh. Okay. So in Montana, we have there's actually 4 nonprofits that operate 211. So Northwestern Montana United Way and Kalispell, so they cover the northwestern region, and then so they're 211, and they're in the process of getting accredited as a call center, but they're taking calls for that region right now. Human Resource Council in Missoula, they handle the western region. Help Center in Bozeman, they're a 211 and also a 988. So, and then Voices of Hope, lastly, with the central region, they're 211 and 988. So we have 2 211 centers that are blended, where they are equipped to take both calls. And then Northwestern Montana Mental Health in Missoula they're not part of 211, but they are a 988 call center. So I think it's important for people to understand that they do go hand in hand somewhat, by using the same database. And if somebody were to call 211, the resource specialists are they know the questions to ask. Somebody might be calling and asking for food, but they know, how to get more information out of them, and it may very well turn into a 988 situation. And if they're not calling an actual 988 center, they will get transferred over, a warm handoff. And as I mentioned, United Way of Yellowstone County, we partner with the state. So our role is overseeing the website for the entire state, and then updating resources for southeastern Montana. And it used to be that 211 was not available statewide, but it is a statewide resource now. We have call service in all counties. So as I mentioned, we're part of a national network, and with that, the call centers go through an accreditation process. It's called an Inform USA. So to be a call center, you have to have gone through the accreditation. And to access it, as I talked about, you just simply dial 211 or go to montana211.org. And when you do call 211, as I mentioned, you'll talk to a resource specialist 24 hours a day, 7 days a week, and they don't ask for your name. It's a free and confidential service. The 211 website, montana211.org, is mobile friendly, and we talked a bit, or in the previous conversation, you guys talked about ChatGPT. That is something that we're looking, we do have funding, and we'll be adding some type of AI to the website just to make it a little easier to navigate through. And the other thing too with the website, it is very customizable. So with the interactive map that Mike showed, that it's very possible to add that on the website, a link to it, if you so choose to do that. You know, and I think that it's great to have the resources in more than one spot, but I'll talk a little bit about like printed directories in a little bit. On the website, you can search by keyword. So I would suggest that you go out and look at montana211.org and do a keyword search for your agency and programs. And if it's not there, then find Elizabeth and I are here all day today. We'll have somebody from United Way that can help you get signed up. And we have on the site, there's quick access, what we call hot buttons, and we do have a hot button that's specific for SMVF as well. We also have a link to the Bright app. So if you are a behavioral health specialist, I still feel like this is echoing. Does it?
Just stop.
Did it? Okay. So the Bright app is the Montana mental health provider. It's a directory. Rather than having multiple providers listed on 211, where if somebody goes and tries to look, if they call even if they were to call 211, they're not going to give them 100 resources. So instead of having those listed, we just direct people to the Bright app. And there's a link on the website, on 211. If you just go to the home page, you can click on Bright app, and then it'll tell you how to be added to that as well. So, you know, people say, well, why would I use 211? We have a printed directory in our office. 211 is for everyone. You know, we can make it customizable to specific groups. Well, we don't want to make it specific to certain groups, but we want to be inclusive of all groups. So we have a seniors area where for aging and seniors can go to the site, and just like I mentioned with SMVF or children and families, whatever it might be. And then it works for providers because it makes your jobs easier. You can look up eligibility criteria for providers, and I understand that you do need the ability to hand people things too, but when you print a directory, it's usually outdated as soon as it goes to print. And so there are ways on the 211 website, if you're looking in a certain category, you can go in and check the ones that you want to print as well. So it's downloadable and printable. Excuse me, and we've made it easy for service providers to add their agency. So on the Providers tab of Montana 211, you can go there and just select your region. You can even just click on the map that's to the left. And you want to first make sure that you're not in the system already. And if you're not, you can just click here and add a new agency in your programs. And then if you're existing and there needs to be changes, because we're only as good as the information that we have in there, so we update resources annually, but we do rely on agencies to notify us or call us back when we make the phone call to them or send a request just to be able to update it. So again, if you're already in there and you have an update, just go in and click to update your agency. And so 211, it's actually been in Montana since 2005. And United Way and Billings got involved in around, I think it was around 2015. We were working on a mental health grant at that time. And so as far as the calls go, I'm looking at, right now I'm showing you statewide calls. There were just over 9,200 phone calls. And of those, only 216 were identified as SMVF. That doesn't mean that, the question is asked of the callers, but there could have been more that didn't identify themselves, but we really want to get that number up, letting people know that it is out there. And oops, I forgot. Let me go back here. And the presenting issues, so basic needs is the biggest. So that includes housing, utilities, clothing, whatever it might be. That's the biggest one. And then the statewide searches, there were just about, 2,300, as you can see up on the screen. So again, I think we have a lot of work to do to get the word out. There should be a lot more users on the 211 system. And what I ask of all of you is to spread the word. So share it with your clients. You might not need the help, but you may have a friend, neighbor, coworker that does need the help. And just to make sure that your agency and programs are all listed on the site. So that is just a high-level overview, but does anybody have any questions for me? Okay. Well, thank you.